my name is Paulette Peláez and I will talk about the intensified glucose control in patients with type 2 diabetes. Definition: diabetes means that blood glucose, also called blood sugar, is very high with type 2 diabetes, the most common. The body does not make or use insulin well. Insulin is a hormone that helps glucose enter cells for energy. Without insulin, there is too much glucose in the blood. Over time, a high blood glucose level can cause serious problems with heart, eyes, kidney, nerves, gums, and the teeth.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Applications in medicine. Longer-term follow-up of glucose lowering in patients with type 2 diabetes may help to clarify the duration of the potential benefit with regard to the cardiovascular disease. Intended follow-up may also can be necessary to relieve the effects of intensive glucose lowering on the outcome of total mortality.
Type 2 diabetes is caused by when the body cannot use its own insulin effectively enough. Type 2 diabetes has become one of the largest health conditions in the UK and the world. Over 2 million people in the UK have type 2 diabetes and over 250 million people in the world. The symptoms of type 2 diabetes can come on very slowly, and often the signs can be dismissed as simply getting old. The sooner diabetes can be diagnosed, the better, as often damage can be done to the body before it is diagnosed. The common risk factors of type 2 diabetes are body size, being overweight, particularly if you're carrying extra weight around your middle, age, the risk of diabetes does go up with age, having a close family member, such as a parent or a sibling with type 2 diabetes, ethnicity, if you're from a South Asian, Middle Eastern or an African Caribbean background, you do have a higher risk of type 2 diabetes. High blood pressure is also closely associated with type 2 diabetes. The symptoms of type 2 diabetes include feeling tired and lethargic, particularly after meals, feeling more thirsty than usual and needing to urinate more often, especially at night, having increased hunger, developing darker skin around the neck or underarms, itching around the privates, thrush, blurred vision, or cuts or sores taking a long time to heal. Type 2 diabetes may be diagnosed with either a urine or a blood test. If either of these tests are not clear-cut, you may be asked to take an oral glucose tolerance test. There are a wide range of treatment options for people with type 2 diabetes. Some people may be able to treat type 2 diabetes through lifestyle changes alone. Some people may be put on to tablets, whereas others may go on to injections such as insulin. When you're diagnosed with type 2 diabetes, you'll likely need to make some lifestyle changes. This can include cutting down on smoking or alcohol, taking more physical exercise, preferably each day, eating a healthy, balanced diet. You may find you need to cut down on carbohydrates a bit more than you're used to.
Pros and cons. Pros. To examine the long-term consequences of the intensive glycemic control on cardiovascular disease outcomes, quality of life and mortality, provides an opportunity to assess inherent effects. Cons. Intensive glucose control was associated with weight and gain during active treatment. Death from cardiovascular cause, death from any cause, any major result of diabetes. Cardiovascular disease risk factors were treated aggressively.
Many patients with type 2 diabetes not treated with insulin self-monitor their blood sugar levels at home. Patients like April Reese.
A couple of times a week, I am testing to make sure that I'm in the right range, or if I feel like something's wrong, I test.
But how effective is self-monitoring for patients like April? Dr. Katrina Donahue and Dr. Laura Young of the University of North Carolina at Chapel Hill and their colleagues studied 450 adults who had non-insulin treated type 2 diabetes. Researchers wanted to know if self-monitoring blood glucose levels affected diabetes control by looking at patients' hemoglobin A1C levels, a measure of longer-term sugar control, or their health-related quality of life. In the randomized trial, patients were divided into 3 groups. One group did not do self-monitoring, the second group did once daily self-monitoring, and the third group monitored once daily too, but also received messages with encouragement or instruction through their meter. The study appears in JAMA Internal Medicine.
After 1 year, we found no significant differences in A1C or glycemic control between the 3 groups. Also, there were no significant differences in health-related quality of life.
The next steps are getting the message out and really helping patients understand, as well as healthcare providers, the message from the study and helping patients feel comfortable recognizing that testing may not be necessary, especially for those who are used to doing it at once or multiple times a day.
Study results do not apply to insulin-treated patients. April Reese says the results are worth a conversation with her doctor about the value of self-monitoring.
I will talk with my doctor about these results so that we can look at my treatment plan and make some decisions moving forward about how I want to be managed.
Laura Berger, The JAMA Report.
ISUI applied in Ecuador. In Ecuador, diabetes is reported as a cause of general mortality. For this reason, these intensive glucose controls are necessary in patients with type 2 diabetes in order to control the disease that diabetes usually brings.
Over the past 2 decades, several studies have highlighted the importance of intensive glucose-lowering therapy, blood pressure control, and statin use to reduce the risk of cardiovascular complications and mortality in patients with diabetes. But the long-term trends of mortality and cardiovascular outcomes of patients with type 1 or type 2 diabetes as compared with the general population are unknown. In a study of patients enrolled between 1998 and 2012 in the Swedish National Diabetes Register, a total of 36,869 patients with type 1 and 457,473 patients with type 2 diabetes were included, along with matched controls from the general population. The outcomes that were assessed were all-cause mortality, fatal coronary heart disease, fatal cardiovascular disease, and hospitalization for cardiovascular disease. The rate of all-cause mortality declined among those with type 1 diabetes by 29%, and in matched controls by 23%, a difference that was not statistically significant. The rate of hospitalization for cardiovascular disease decreased by 36% among those with type 1 diabetes and by 9% among matched controls, a decrease that was significantly greater for the diabetic group. The rate of all-cause mortality decreased by 21% among those with type 2 diabetes and by 31% among matched controls, a statistically significant difference that favored the control group. The rate of hospitalization for cardiovascular disease decreased by 44% among those with type 2 diabetes and by 29% among matched controls, a statistically significant difference that favored those with type 2 diabetes. The authors conclude that mortality and cardiovascular disease have declined for patients with diabetes. For most cardiovascular outcomes studied, event rates have decreased at least as quickly for patients with diabetes as for matched controls. However, as compared with matched controls, patients with type 2 diabetes had a smaller reduction in fatal cardiovascular outcomes. Full study results are available at any.
Conclusion. Participants with type 2 diabetes who had been randomized to the intensified glucose control for 5 years had a lower risk of cardiovascular events. There was not evidence of an inherited effect on mortality benefit with the intensified glucose control.
Patients with type 2 diabetes should be treated to achieve an A1C level between 7 and 8% rather than 6.5 to 7%, the American College of Physicians recommends in a new guidance statement published in Annals of Internal Medicine.
Treatment with drugs targeted to 7%, in contrast to 8%, does not prevent heart attacks or strokes, but it does result in substantial harm, including low blood sugar, increased medication burden, and increased cost.
A1C levels reflect average blood sugar levels over about 3 months. A reading over 6.5 indicates diabetes. The rationale in guidelines that recommended lower treatment targets is that more intensive blood sugar control over many years would reduce complications from diabetes.
The evidence for reducing serious complications was inconsistent. It was limited only to reducing less serious complications, such as excess protein in the urine.
ACP recommends that patients and their doctor personalize goals for blood sugar control based on a discussion of benefits and harms of drug therapy, patients' preferences, general health, life expectancy, treatment burden, and costs of care.
The ACP recommendations were based on drug therapy. But if a patient can achieve low A1C levels with lifestyle modifications, such as diet, exercise, and weight loss, then those targets are appropriate.
If patients achieve an A1C of less than 6.5%, ACP recommends clinicians consider de-intensifying drug therapy by reducing the dosage of current treatment, removing a medication if the patient is currently taking more than one drug, or discontinuing drug treatment.
Studies do not show benefit treating to an A1C level below 6.5, but they do show harms. And for that reason, the college recommends for patients with A1C below 6.5 to consider de-intensifying therapy.
For more information, go to acponline.org.